Bangladesh is struggling to bring a rapidly spreading measles outbreak under control. Since mid-March, the outbreak has claimed the lives of more than 450 children. Hospitals across the country are overwhelmed with patient numbers exceeding capacity and stretching healthcare services to their limits. Authorities have also acknowledged shortages in vaccine supply, further complicating efforts to contain the disease. Our next report gives you the details.
Horrific scenes emerging from the hospitals of Bangladesh. In crowded pediatric wards, infants and toddlers lie battling high fever, persistent cough, breathing difficulties and the telltale rash, the sign of measles. Families are arriving from distant rural districts, often after days of exhausting travel, hoping to access better treatment in city hospitals. A rapidly spreading measles outbreak is putting an immense pressure on an already overstretched healthcare system.
Initially, the doctors at my village could not diagnose this as measles, but we realized it was measles as all the symptoms matched. My daughter had a fever, cough and flu. Then we saw she was drooling. We were all appalled. Then we decided we would not stay here. We would take her to Dhaka.
For the last 13-14 days, we've been coming back and forth to the hospital like this. Today, things are really bad. I didn't think he'd have to be put on oxygen again. He isn't able to eat anything at all.
According to the World Health Organization and UNICEF, the outbreak has spread across almost the entire country, with tens of thousands of suspected cases emerging within just a matter of weeks. Children under the age of 5 account for the overwhelming majority of infections, while infants too young to receive full vaccination remain among the most vulnerable. On May 4th, Bangladesh recorded its deadliest single day of the outbreak so far, with 17 children dying within 24 hours. In densely populated urban centers such as Dhaka and in vulnerable regions like Cox's Bazar, home to some of the world's largest Rohingya refugee camps, the outbreak has spread with alarming speed. Overcrowded settlements, fragile healthcare infrastructure have created conditions where containing the virus has become increasingly difficult. Measles itself is among the most contagious diseases known to humanity. An airborne virus, it spreads rapidly through respiratory droplets, causing high fever, respiratory distress. The World Health Organization estimates that at least 95% vaccination coverage is required to interrupt transmission and achieve herd immunity, a threshold Bangladesh has yet to consistently attain.
I have a question for the government. We vaccinate our children to stop diseases, for reducing their life risks. If we still have to run around haphazardly with our children for treatment, then what is the point of these vaccines? I doubt its usefulness.
Bangladesh has nevertheless made significant progress in childhood immunization over decades, raising full vaccination coverage from roughly 2% in the late 1970s to more than 80% today. But it still remains insufficient to fully prevent outbreaks, particularly when gaps in immunization continue to leave large numbers of children exposed. In response to the crisis, health authorities working alongside UNICEF, the WHO and security forces launched an emergency measles rubella vaccination drive at the beginning of April. However, vaccination coverage had fallen far below the level needed for herd immunity, leaving large pockets of vulnerable children exposed to the infection. Bangladesh's Health Minister Sardar Mohammad Sakhawat Hussain has said that no doses were available when the BNP-led administration assumed office as the outbreak intensified. A court order has since been sought to bar former interim chief advisor Mohammad Yunus and 24 others from leaving the country, thus investigating the alleged vaccine shortage during that period. The issue has now escalated into a wider political and administrative controversy, with questions being raised over accountability across successive governments. But outside overcrowded hospitals for families waiting anxiously beside sick children, those political debates feel distant. What matters most to them is ensuring their children survive and stopping the disease that should never have been allowed to spread so widely in the first place.